Okay, good afternoon, guys. And today we will discuss about tibia and fibula, the bones of the lower limb. And in the previous lecture, we have discussed about femur and the hip bone. So let's get started. First of all, the discussion is about the tibia. Okay, the tibia is the medial bone, okay, and fibula is the lateral bone of the lower limb. So the tibia has an upper end and it has a lower end. So upper end has two condyles. Okay, it has two condyles, and the medial condyle and the lateral condyle. So these condyles articulates with the above femur to form the knee joint, and there is intercondylar area, as you can see in the anterior aspect. This the intercondylar area is between the two condyles. Anteriorly, it also has tibial tuberosity, as you can see here, which is the surface for the attachment of the muscles, and it also has groove for semimembranosus muscle on the posterior aspect, as you can see here. Okay, it has groove for semimembranosus muscle, and it has a fibular facet to form the superior tibiofibular joint. Okay, so let's revise it. Upper end has two condyles, medial and lateral, which articulates with femur to form knee joint. Anteriorly, it has intercondylar area and also has tibial tuberosity slightly downwards. And on the posterior aspect, it has semimembranosus muscle groove and has the fibular facet for the articulation of the fibula and form superior tibiofibular joint. Okay, upper end has been discussed. So lower end of the tibia, it contains five surfaces. As you can see that tibia lower end is slightly larger, okay, than the upper end. So it has five surfaces. First is the anterior surface. Okay, as you can see here, it is the anterior surface. The posterior surface has two grooves, as you can see here, groove for tibialis posterior muscle and groove for flexor digitorum longus tendons. These two grooves are present on the posterior aspect of tibia. Laterally, it has fibular notch, as you can see here. It has fibular notch for the articulation with the fibula, and it forms inferior tibiofibular joint. Medially, it projects downwards to form the medial malleolus. Okay, this is the medial surface, and inferiorly, it has articular surface for the talus to form the ankle joint. Okay, five surfaces anteriorly and posterior. Posterior has two grooves for tibialis posterior and flexor digitorum longus tendon. Laterally, it articulates with fibula to form the fibular notch, and it forms inferior tibiofibular joint. Medially, it forms medial malleolus, and inferiorly, it forms articular surface with the talus, one of the bones of the foot. We'll discuss in the next lecture, to form the ankle joint. Okay, the tibia is almost done. Then shaft. The shaft is the area between the two ends of the long bone, and it contains borders and surfaces. Okay, there are three borders. Okay, the medial border. Okay, this is the medial border. The lateral border. Okay, the lateral border, which is also known as the interosseous border. This is the lateral border because interosseous border is between the two bones. As you know that fibula is present on the lateral aspect of tibia. So interosseous means that between the two bones there is the border, and there is anterior border here. There are three surfaces, the lateral surface, this one, the medial surface, and the posterior surface. The posterior surface has two lines, or the posterior border has two lines. First is the soleal line, and the second is the vertical line. And these lines are just for the identification of the surfaces of the tibia. So there are three borders: medial, the lateral, interosseous, and the posterior border, and three surfaces: anterior and medial and posterior surface. Okay, let's discuss about the fibula. Fibula is the lateral bone of the lower limb, and it has head, neck, and the styloid process. Also, it has the lateral malleolus. Let's discuss it. First of all, head of the fibula is upwards projection. It is also known as the styloid process. Okay, this head of the fibula is also known as the styloid process, and neck is slightly below the styloid process. Okay, neck, and articular facet between the tibia and fibula on the upper end is known as superior tibiofibular joint, as we have discussed when we were discussing the tibia. Okay, the lower end of the fibula contains only lateral malleolus. Okay, the fibula, it has lateral malleolus, as you can see here in the diagram. Also, posteriorly, it contains groove for peroneus brevis and longus muscles. Tibia posterior and contains groove for tibialis posterior and flexor digitorum tendons, but fibula posterior surface has groove for peroneus brevis and longus. The medial surface has three components or three parts, so let's discuss them. First is the articular facet for the talus. As you can see here, this one, this is the articular facet for the foot bone to form the ankle joint. This is for the talus. The medial malleolus, this is the medial, no, this is the malleolar fossa. Okay, it's the malleolar fossa, and the triangular area to form the inferior tibiofibular joint. So the fibula contains lateral malleolus. It has posterior groove for peroneus brevis and longus muscles. Medial surface has articular facet for the talus, malleolar fossa, and triangular area to form the inferior tibiofibular joint. The shaft of the fibula is same as the tibia, but its interosseous border is the medial one. Okay, because the tibia is present on the medial aspect. So let's discuss both of them in this diagram. The styloid process is the head of the fibula. Then there is the neck, and this is the shaft. And on the lower end, it has lateral malleolus. Okay, and this is the inferior tibiofibular joint. Tibia has two condyles, and it contains intercondylar area. It has tibial tuberosity. Then shaft and the lower end contains medial malleolus and the inferior tibiofibular joint, and this is the superior tibiofibular joint. Intraosseous border is present between the two bones. Okay, this is the intraosseous border. So there are several muscle attachments to these bones, but we'll discuss the muscle attachments in the subsequent lectures. So this was for the tibia and fibula. I hope you understand this, and I will see you in the next video. Till then, goodbye.